social inequalities. Cholera, just like plague in the Middle Ages, or at least in the early modern period, was very much a disease of the poor. It was confined very largely to squalid urban tenements. It was associated intimately with filth, with large accumulations of filth. And you can see here this cartoon is called A Court for King Cholera. These are the kinds of conditions which were seen at the time to be conducive to the propagation of cholera. And so most people tended to see cholera as a disease which was partly contagious, communicated from one place to another, often very easily by steamships and so forth. But also, it was a disease which could only thrive in filthy circumstances. So cholera is very much a kind of measure of modernity. It throws into sharp relief the contours of a new modern civilization, but particularly throwing the spotlight on many of those aspects of modern civilization which people would rather forget. And it prompts a great deal of soul-searching, both among the officials, among the medical profession, but also among, of course, among the people who are directly affected by it. Now, the arrival of cholera presents, in the 19th century, most governments with very difficult problems, with real dilemmas. Because cholera is seen to be so closely connected with the new global economy, because it's spread by the new technologies and communications which make this economy possible, and because it thrives in the conditions which are generated by urbanization, industrialization, and industrial capitalism, it really goes to the heart of this whole system. So the big question then arises, well, how to try to get rid of this disease which threatens the system without destroying the system itself? And this was obviously a very tricky thing for governments to come to terms with. And they had to try to tread a particularly fine line, both to avoid disrupting the system which they were seeking to defend, but also to avoid provoking civil unrest. Now, cholera tended to breed distrust when it arrived. The afflicted populations of industrial cities in Britain, or even in colonial contexts such as India, where cholera was seen to be very closely related to to conquest and to the consolidation of colonial rule. Because of this, because it was associated very often with these new circumstances and with the arrival of colonial unrest, it meant that any kind of intervention to try to prevent the disease would often be seen to be very provocative, because it was aimed at the poor, it was aimed at the peasantry in India, or the urban working classes. And in many cases, when governments tried to intervene to prevent the spread of disease by imposing quarantines or even by introducing new sanitary measures, they would face a fierce backlash. And sometimes this would limit what governments could do. So it's a very difficult consideration for governments about just how to deal with these problems. And very often, as I've said earlier, cholera tends to, like many other pandemic diseases, tends to be closely related to other kinds of upheavals, and indeed often produced by them, the social circumstances which come about as a result of wars and rebellions, the mass migration of people, deteriorating infrastructure and sanitary conditions. All these things tend to be associated with periods of upheaval. And so when cholera often breaks out, it's in that context, and that makes it doubly difficult to deal with. And this was a classic case of this was the so-called Indian Mutiny and Rebellion in 1857, where the rebellion of the sepoys, the Indian troops, and other sections of Indian society came at the same time as the cholera outbreak, which ironically affected the British far more than the Indians. But for the Indians, this had a certain kind of meaning. It was seen to show that their oppressors were very vulnerable. And so it's just a kind of reverse relationship, I guess, between the way in which the epidemics of cholera were normally perceived. Now, during the 19th century, there were many other pandemic diseases. Cholera was by no means the only one. During the 1850s, there was a resurgence of yellow fever, which spread very rapidly through the Atlantic, affecting the Americas, but also crossing the Atlantic to affect Europe to some extent. This is very, very closely associated with the boom in trade during the 1850s, and most contemporaries thought that was the case. There were numerous other epidemics during the 19th century, which also underlined the relationship between the global trading network, but also war, migration, and colonialism. A classic example of that would be the so-called Third Plague pandemic of the 1890s and the early 1900s, which started off in Yunnan province in China, spread very rapidly, well, in the context of a civil war, spread rapidly via the opium trade down to Hong Kong, and thereafter to Bombay and most other parts of the world, as a result largely of global trading systems. And then during the 1890s, which I didn't mention on the slide here, there's an epidemic of the so-called Russian flu, and later the more infamous epidemic in 1918 to 1919, which coincides with the end of the First World War. And this epidemic, the so-called Spanish flu epidemic, killed, well, according to some estimates, up to 50 million people, most likely somewhere between 30 and 50 million people, the most devastating single epidemic ever in human history as far as we can tell. Now, all of these diseases, just like cholera, as I said, pose real dilemmas to governments in particular, particularly the governments that dominated the new global order, the new trading system. So they had to find a way of dealing with these problems without destroying the system that they wanted to uphold. And in the course of the 1890s, the early 1900s, in the context particularly of the Third Plague pandemic, they began to develop a way of doing that enabled them to preserve the system without and at the same time to reduce the threat of disease. And one way of doing that was to work out a sort of standardized system of international quarantine, medical inspection, and so forth that was really quarantine with a light touch. It didn't disrupt the economy too much. One of the reasons they were able to do that was because there was growing confidence in sanitary measures, in ports in particular. And this often meant, particularly in colonial contexts, that they had to improve surveillance and they had to sometimes impose sanitary measures, often on unwilling populations, in a very draconian way. So we have a kind of paradox here. The light touch quarantine system that most of the great powers want at this time can only be imposed or constructed as a result of often draconian sanitary measures in parts of the world in particular, which are seen to be the ones producing the diseases, in other words, mostly Asia and Africa, and also really tough surveillance of a very tight surveillance of the movement of disease around the globe. And the Americans were really pioneered this from the 1880s. And there was a sort of, if you like, a kind of sanitary version of the Monroe Doctrine, where the Americans began to intervene increasingly in the very early 19th century in the affairs of particularly Latin American countries and also China and Japan, where they tried to monitor the spread of infectious diseases. So they wouldn't necessarily need to have very tough quarantine measures in their own ports and therefore avoid disruption of trade. So this is something I call the new liberal consensus. It's shaped by Britain, the United States, and France. And it's very much about disease containment and surveillance. But it's also, to some extent, about sanitary reform and very well-regulated sanitary organizations. After the First World War, I don't have time to say too much about this, there is a shift in the context of the League of Nations and then later on under the WHO towards a more rounded understanding of disease and health.